CAREC countries, dear colleagues from ADB and development partners, ladies and gentlemen, a warm welcome to the virtual regional workshop on promoting regional health cooperation under CAREC 2030. The workshop is organized by the CAREC Secretariat. My name is Xinan Hu. I am Principal Regional Cooperation Specialist at the CAREC Secretariat in ADB. I will be pleased to facilitate the workshop today together with my colleague, Ms. Kirti Ramesh, Social Sector Specialist at the ADB's Central and West Asia Department. Just now, my colleague Irene has shown you how to use the functions of the Zoom link of the Zoom. And so I hope that you are familiarized with the Zoom functions, but if you still have some difficulty with the functions, you can type your messages in the chat box so that our support team will be able to help you. Let me hand over to Kirti to say a few words. Kirti, over to you.
Thank you very much, Xingyan. Good morning and good afternoon. It is a pleasure to welcome you all to the virtual and regional workshop promoting regional health cooperation under CAREC 2030. The main objective of today's workshop is to present and solicit feedback on the CAREC health scoping study and initiate future dialogues on health cooperation under the CAREC platform. The study was prepared by this CAREC Secretariat in ADB's Central and West Asia Department, supported by the Regional Cooperation and Operations Division and the Social Sector Division. The workshop will be co-chaired by Ms. Rie Hiraoka, Director of the Social Sector Division, and Mr. Safdar Parvez, Director of the Regional Cooperation and Operations Coordination Division. Thank you very much to all for taking the time to join us today, and we look forward to this workshop. Over to you again, Xingyan.
Thank you, Kirti. And we will now proceed to the opening session. In this session, we are pleased to have three speakers. So Mr. Safdar Parvez, who will deliver welcome remarks, and Mr. Patrick Osawiz, Chief of the Health Sector Group of ADB, who will present the overview of COVID impact in the CAREC region and ADB's responses, and Ms. Dorit Litzan, Regional Emergency Director of World Health Organization's Regional Office for Europe, who is today's speaker. Before I invite all the speakers to speak, I would like to kindly request you to be brief in your speech or presentation. Without further ado, may I invite Mr. Safdar Parvez to deliver welcome remarks. Safdar, please.
Thank you very much, Shinglin, and it is my honor and my privilege to officially welcome you all on behalf of the Asian Development Bank and the Secretariat of the Central Asia Regional Economic Cooperation Program to this meeting today. We are absolutely delighted that we have delegates from 10 countries, high-level health sector and other officials that are joining our deliberations today. We are also very pleased that we have a number of important development partners joining the meeting today, including the Global Fund, JICA, World Bank, WHO, UNICEF, KFW, and I apologize if I missed someone else who is already here today. We also have a strong ADB delegation at this meeting. And we have our technical director, Rie Hiraoka, whose division is co-leading this work. And we have our chief of our health sector group, Patrick. We have our colleagues from the East Asia department. We have our country directors. We have our CAREC secretariat staff, and we have representation from other parts of ADB as well. And just because some of you may not be fully aware of what CAREC is and what CAREC does, let me just tell you that CAREC is essentially a partnership of 11 member countries and a whole list of development partners that are working together to promote development through cooperation in the hope that we together will be able to promote sustainable growth and poverty reduction in the CAREC region. CAREC has been operational since 2000, so about 20 years, but most of its work historically has focused on issues of connectivity and infrastructure. But in 2017, we prepared a new strategy under which we brought to the center a focus on people living in CAREC. And under that focus, we felt that promoting regional health security should be a core aim of the CAREC program. And this is in recognition of the fact that our CAREC countries remain prone to many infectious diseases as well as non-communicable diseases, as well as transboundary animal health related diseases, given the exposure of the vast majority of population to agriculture and livestock in our region. We have felt that regional efforts are essential to complement national strategies to promote health security in the national countries as well as overall in the region. And this is essentially because diseases know no borders. The COVID-19 impact this year is only the latest manifestation of the fact that diseases multiply, they cross borders, and large swaths of population are affected at the same time. It was in this regard that we decided to commission a scoping study to examine what role regional efforts can play in promoting health security in our CAREC region, and how can CAREC platform act as a catalyst or as a promoter to strengthen regional health and regional health security issues in our countries. Together with the scoping study, we have also recently approved a technical assistance to promote regional health security, under which we will also be working on preparing a regional health sector strategy. And as Kirti mentioned, I think the objective today of our meeting is really to get your feedback on the scoping study that we had circulated to you earlier, and to have a broad-based discussion on key challenges and opportunities that we see in promoting regional health security by working together on a platform. And we also feel that this platform also provides an opportunity for knowledge sharing and lesson learning from our individual and collective experiences of dealing with pandemics such as COVID-19, and to bring everybody together on the same page. The meeting today is just the first step, and we hope to institutionalize a network of health sector professionals and create a health sector working group in order to deliberate and devise policies, procedures, and projects for strengthening our collaboration on promoting regional health security going forward. With this, I would like to thank you all, and I look forward to interesting discussions in today's meeting. Thank you very much.
Thank you, Safdar, for the welcome remarks and for providing a very comprehensive background for ADB to undertake the scoping study, and also for highlighting the importance of regional cooperation for health. May I now invite Mr. Patrick Osawi, Chief of ADB's Health Sector Group, to speak. Hi, Patrick, are you there?
Hi.
Hi,
I'm
yeah,
here.
please, yeah.
Yes, thank you very much, Ria, Safda, Kithi, and the team for organizing this a very important event. Can we go to my first slide, please? So as we know, the coronavirus has had a devastating effect on the global community. To date, almost, can you change the slides, please? So to date, sorry to take, okay. I need to go to the English version. This is a Russian version. So so to date, 38 million people have been infected with with coronavirus, and about 1 million people have died. This is one of the biggest challenges that the global community has faced. If you go to the slide on the update, the CAREC region, the slide number 2, the CAREC region has not been spared. If you look at the numbers as of October 13th, there have been 736,000 cases and over 16,000 deaths. The pandemic in the CAREC region is mostly driven by Pakistan, although in the situation in Pakistan is improving compared to several months ago, and also Uzbekistan. Next slide, please. Now, if you look at the economic impact, this has been really, really negative in the CAREC region. And there's almost a minus 1.3% economic contraction, which was driven mostly by lockdown and quarantine that decreased consumption and also decrease in trade and tourism. This is something that we're seeing across the world. But luckily that in the CAREC region, the projection is that in 2021, the growth will rebound to about 2.9%. Of course, assuming that we don't get this a second wave. We are beginning to see signs in Europe whereby many countries are having a second wave of infection and so on. So if the situation continues to improve, then there'll be a rebound in the CAREC region. Next slide, please. Now, as ADB, we have responded in the CAREC region and across all our developing member countries by supporting 4 things. First, we provided emergency assistance loans in grants for countries to be able to first to purchase the life-saving equipment like PPEs and so on, to buy test kits, to be able to increase and expand the testing capacity for most countries, and also to equip medical facilities to have equipment like ventilators and so on. Concurrently, we're also providing significant technical assistance for the countries, and you can see on the right-hand side the countries that we've been supporting. And then we've also been as part of a disaster assistance fund. We provided $12.5 million to Kazakhstan, Mongolia, Pakistan, Tajikistan, and Uzbekistan. And also we worked with some of the countries to reprogram some of the resources that they had to be able to support COVID. So in a nutshell, we've spent more than $650 million supporting COVID-19 in the CAREC region. Next slide, please. So the region remains highly susceptible to outbreaks, and the contributing factors include high regional burden of infectious diseases and emerging infectious diseases, the significant cross-border travel, including transboundary population and livestock movement from one country to another country. And we know that most pandemics are very much linked to close proximity to animals. The SARS pandemic and also even the COVID-19 pandemic were very much associated with animals and so on. There's also varying degree of health system capacity. Some countries have stronger health systems than others. And then there's also high out-of-pocket spending on health. In situations whereby people are forced to pay for health, usually when people have mild symptoms of COVID, for example, or mild symptoms of any condition, they are unlikely to go for healthcare and so on, which by delaying going for healthcare, if they have COVID, they're basically infecting other people and so on. So this is a big challenge in the region. And also exclusion of migrant workers from access to essential health services in certain situations. So if there's a migrant worker who has COVID or any other infectious disease and is not able to access health services, they are still infecting their family members and their close associates, including people at work. So these are the issues that are quite central, and why taking a regional approach is quite important, so that countries can work together, help each other, and respond collectively instead of individually. And next slide. So on my last slide, and this is my last slide, one of the biggest and emerging challenges now is how we are going to support countries to have vaccines. The vaccines is likely to be a game changer. The first set of vaccines might not be 100% accurate, but of course they'll be fairly accurate. And so the big issue is that how do countries obtain vaccines? And then secondly, how do they deliver the vaccines? And so what ADB is doing, as we are engaged in, we're establishing a task force that brings various experts from international organizations, from pharmaceutical industry, from academic institutions, from universities, and the specialized agencies to basically help us organize a capacity building effort to support and also provide knowledge to our developing member countries individually and also collectively, similar to what we are doing now. We are also participating in major, these many organizations like WHO and UNICEF have organized regional task forces and so on, and we are part of those task forces. We are also in very close collaboration. We engage with Gavi, regular conversation with Gavi, and also working very closely with World Bank, including opportunity for co-financing some of the activities in some of the countries. We are also providing significant TS, because once a country gets the vaccines and the vaccine arrives at the port or at the warehouse in the capital city, what exactly do they do? So even before that, there's significant preparation that is required. For example, assessments that need to be done. So COVAX, basically UNICEF, WHO, and Gavi have come up with a tool to assess countries' readiness and so on. And so we'll be working with the countries to provide resources for assessment where necessary. Some of the countries already did assessments, and therefore they already have the information. But once you do that, the second is who gets the vaccine first, because a country will not get all the vaccines that they need on day one. So if they're going to provide the vaccine to the 3% of the population, say health workers and people with pre-existing conditions, who are these people? What's the definition of a health worker? How are they going to roll it out? If they want to increase to 20% of the population, including more people, how is this going to, what are the various scenarios that they should plan? And then the execution mechanism, how is this going to be executed and so on. Second, the issue of cold chain. How is the cold chain going to work, particularly since COVID-19 will focus mostly on adults. Most of the cold chain right now focus on children and so on. The issue of communication. Many people might be reluctant to take the vaccine. How do you develop a communication strategy to educate people about the benefit of the vaccine and so on? The IT system that is required. Many, other than 2 vaccines, the majority of them are 2-dose vaccines, and some of them will be given 1 dose and then another dose 1 month apart. How do you ensure that whoever got the first dose got the second dose? That whole logistics arrangement around that, and the IT system to be able to track and trace people and so on. And also looking at the people who are getting vaccine, as some falling sick, can you respond quickly and then report it back to the committee at the national level that maybe if with one vaccine or another, we are seeing some adverse outcomes and so on. So there are lots of capacity that's required between now and maybe early next year when vaccines will be available. Also, lastly, as a financing institution, we are also in discussion internally how we can support countries to finance vaccines, either through COVAX, which is the mechanism that has been set up. There'll be more discussions around that. Or if they choose to go bilaterally, in some of the countries might decide to go bilaterally to specific manufacturers and so on, and engage in those discussions and ensuring that those vaccines are safe and approved by WHO through emergency use authorizations and so on. And also we are collaborating with some of our countries that have capacity to manufacture vaccines. Kazakhstan can manufacture vaccines in your region, Indonesia, India, Vietnam, and so on. So we engage with them through by providing tactical assistance and financing to expand capacity production, because in 2021 and 2022, we need about 4 billion doses of vaccines, and that's quite significant. Thank you very much.
Thank you, Patrick, for providing a comprehensive overview of ADB's responses to COVID and also COVID's impact in the CAREC region, and also for bringing up the important issue of getting the country ready for the COVID vaccines. Now, may I invite Ms. Dorit Litzan to deliver keynote speech on the importance of regional cooperation in addressing health threats. Ms. Dorit Litzan has extensive experiences in controlling communicable diseases in the European region and elsewhere. We are very fortunate to have her here today with us. So, Dorit, the floor is yours, please.
Yeah, thank you. Thank you so much. I hope that you hear me. And the respectful moderator, Mr. Paves, Mr. Oseire, honorary leaders, colleagues, and friends. On behalf of the WHO Regional Director for Europe, Dr. Hans Kluge, on behalf of the WHO representatives to the countries represented here and other colleagues from WHO, I would like to really thank ADB for inviting us to this important event. The COVID-19 is more than a global health crisis. It is an economic, humanitarian crisis and crisis in security. Also, human rights issues have been raised. COVID-19 has disrupted billions of lives, upended the global economy, and is the greatest global security threat in our world today and for the many, many years. The pandemic has revealed the weakest links in our societies. The United Nations in particular is concerned about the impact on vulnerable populations, migrants, refugees, women, children, older people, persons with disabilities, indigenous people, and those on low income, especially in countries with weaker health systems, and all those that are faced with humanitarian crisis. The pandemic has ignited a vicious cycle with personal, economic, social, and mental health burdens, and relates to political and diplomatic unrest with increased cynicism and anger. The global stress test that the pandemic has posed us has been exposing our society's weaknesses. These ingredients must be addressed urgently. We all wish to wake up in the morning after the pandemic into a better world. For this, we need to practice togetherness. Coming out of this crisis will require a whole of society, whole of government, and yes, a whole of world approach, driven by national unity and international solidarity. Let me tell you the situation today. Globally, nearly 38 million COVID-19 cases and over 1 million deaths have been reported to WHO. This is a marked increase in the WHO European region, with more than 70,000 cases and 1,000 deaths a day in the past week. The disease is spreading exponentially in many countries and areas. The super spreading settings are usually social gatherings, events and care homes, food production and other industrial facilities, and due to travels. Many countries are putting restrictions on gatherings, on business hours, wearing masks, movement restrictions and travel, and in their attempt to prevent national lockdowns and to break the chain of transmission. Let us be clear, no matter what stage a country might find itself now, It's never too late to turn the tide. With trusted leadership, clear and comprehensive strategies, consistent communication, and an engaged, empowered, and enabled populations, countries can bring the virus under control. Effective vaccines, diagnostics, and therapeutics are vital for ending the pandemic. We heard about it before. We must not lose focus of other health issues, however. We must ensure continuity of essential people-centered health services. We need to better manage the economy of well-being. Investing in health is not just spending money, as it is a key for economy and well-being, which comes in a package of society's pro-human norms and values. Throughout the current pandemic, WHO has been scaling up our support, producing rapid situation assessment, collecting clinical information from countries, and analyzing this data to underpin policy making and strengthen response activities. Provision of guidance, training tools, operational and logistics support, interventions in all areas of the response. WHO emergency hubs are the anchor for this operation, and the one that is actually working with the countries in this meeting is based in Kyrgyzstan. 10th month into the pandemic, we have learned a lot about how to manage the virus here. And there are some key points. First is, don't underestimate this virus and its impact. This is, yes, a small virus, but it had settled well into humanity and some of the animals, and has been harming and killing more than anyone can imagine. We also learned that humanity is one and countries are interlinked. Therefore, to overcome global challenges, we need to use global solutions. This is a good opportunity to thank ADB for providing such a platform. We, the United Nations and partners, have created the solidarity platforms for funds, for development and access to all in need to diagnostics, treatments, and vaccines. We ask to stick to science and to learn to adapt to the new information without anger. We were running behind the virus. Now we believe that we caught it, and we are learning more and more each day. Forgive us when we are adapting our guidance. Social values and addressing existing disparities are mirrored in who is sick, who is at risk, who is poor. Shielding these groups and the older people is a must. Robust governance with responsible leadership is one of that engages communities and ensures agile systems and sustained investments. Social norms and values should be revisited. Stronger solidarity for universal access to health, primary care included, education and social services based on equity and ethics. And of course, evidence-driven policy that is enabling political environment and political environment that enables people to comply. Health systems capacities have to be strengthened with essential workforce at the center. Essential workforce is essential. Basic public health functions should be in place. Saving lives and protecting livelihoods are two sides of the same coins. We should not compete with each other. And we have to remember that school closures has its impact on child well-being, and decision on this issue should be handled with care based on data. This is a good opportunity for green environment and economy of well-being to be really strengthened. And we learned that advanced technology is not enough. Access is a key. And preparedness is the arrowhead. Even the strongest were not prepared. Health security and preparedness should be better integrated. We are offering countries with a standardized tool to assess and upscale their preparedness capacities. We call it the Intra-Action Review, IAR. And I thank Uzbekistan for being the first to complete it and looking forward for more countries to join. And partnership is a key. No man is an island and no country is a universe on its own. We should not leave anyone behind or at the margins. Humanity is not safe until all are safe. I really thank ADB for your contribution to the building of resilient health systems and for supporting platforms with the countries and leaders, communities, partners, including us. Each and everyone on earth today should see her or himself as the delegate of the generations to come. This is the necessary change. I
Thank you, Dorit, for your very inspiring. And thank you for reminding us again that the COVID-19, which is still evolving, how it has impacted us. And all five have been particularly our agile health system, which are hit the most. And also thank you for introducing WHO's role in helping countries fighting the virus, and also how important to be partner together to fight this virus, and then so that the national unity and international and regional solidarity is the most important to fight this virus. Thank you again for your speech. And now this ends the opening session, and then we will come to the main session discussing the draft scoping study of regional health cooperation in CAREC. So without further ado, let me invite Kurti and Ms. Masha Katiwata-Savchuk to jointly present the findings of the scoping study. Masha is an ADB consultant, and she's also an experienced health specialist. And Masha has led the preparation of the scoping study. So Kurti and Masha, the floor are yours. Please keep your presentation as short as possible. Thank you.
Thank you very much again, Xinglan. I think I'm seeing the Russian version in the English interpretation. If this is the case for others, may I please request that this is changed into English? So thank you very much. It's a pleasure for us to now outline the key findings of the CAREC health scoping study in this presentation. The study was undertaken throughout all of last year and the first half of this year through a desk review and literature review. Next, please. I am still seeing the English version. If this is still the case for others, may I request to change the slides into the English version for the English translations? Thank you very much. The study was developed in the context of the CAREC 2030 strategy. And in the CAREC 2030 strategy, health cooperation has been identified as part of the Human Development Operational Cluster, which is one of the 5 operational clusters under the strategy. The study was commissioned to further explore the potential role of CAREC to enhance regional health cooperation in the health sector, as my colleagues previously have outlined. And indeed, one of the main findings in the study is that there is considerable scope under the CAREC platform to expand on cooperation for health. The study covers 4 sections: regional health trends and challenges, regional solutions for regional challenges, priority areas of regional cooperation, recommendations, and next steps. These will be summarized in turn in the subsequent slides. The full draft report had been made available ahead of today's meeting. Now over to you, Masha.
Good morning and good afternoon to esteemed government representatives, partners, and experts. It is my pleasure to now present the substance of the scoping study. Due to time constraints, I will provide only a concise overview of the identified trends, challenges, potential regional mechanism for cooperation, and priorities that were already identified in the scoping study. The study itself, as pointed out by Kirti, provides more details and examples. And if you have any follow-up or additional questions, we will of course be able to answer them. In the first section, I will go over the health trends and challenges identified in the region, as well as the regional factors that can have further impact on the health trends. Next slide, please. As you can see, the slide illustrates the burden of disease in the region. The region suffers from a triple burden of disease, which consists of non-communicable diseases, also referred to as NCDs, infectious and emerging diseases, and injuries. The highest and growing burden is represented by non-communicable diseases, and these include cardiovascular disease, cancers, respiratory disease, diabetes, and others. NCDs are also very closely linked with risk factors, such as unhealthy diets, physical inactivity, tobacco and alcohol use, and several others. The second biggest burden, as you can see, is represented by infectious and emerging infectious diseases, which, as the COVID-19 pandemic has shown, remain a serious threat, and not only in the CAREC region, but globally. The CAREC region is especially prone to outbreaks and epidemics of infectious diseases and emerging infectious diseases due to its increasing regional connectivity, population mobility, urban hubs, and livestock raising and trading. The slide also demonstrates that changing trends and demographic shift that underlines these statistics. Over the past decades, the population health and nutrition status of CAREC countries has improved dramatically. For example, investments in immunization and other neonatal services have helped to significantly reduce under-5 mortality. The average regional under-5 mortality dropped from 90 down to 27.5 deaths per 1,000 live births. In addition to neonatal mortality decreasing, investments in health services and access to medicines have further positively impacted life expectancy. The regional life expectancy has increased by almost 7 years. And currently, 65-year-olds and older currently make up about 10% of CAREC's population, while under 14-year-olds make up around 30% of the population. And this mix is changing as countries tend to age, especially with such countries as PRC and Georgia specifically more affected by the aging trend. These demographic changes contribute to changes in disease burden. Population aging coupled with changes in lifestyles means that the CAREC region is facing higher costs associated with the treatment of chronic illnesses and longer-term treatments that are more expensive than preventive treatments on average. You can also see that injuries is a third burden. However, it remains a challenge in fragile country settings and is on the decline in most of the region. It is also important to underline the relationship between infectious diseases and NCDs that is not visible in this slide. However, there is an underlying relationship that is important. For example, several of the highly prevalent infectious diseases in the region, such as hepatitis, can lead to longer-term chronic conditions, for example, cirrhosis and liver cancer, and often require expensive, longer-term treatments. While infectious diseases such as tuberculosis, which are also quite prevalent, have evolved into more resistant forms and also require long-term and more expensive treatments. The COVID-19 pandemic has also further underlined the relationship between NCDs and infectious diseases, with people with pre-existing conditions, such as, for example, diabetes and cardiovascular disease, being more susceptible to more severe disease trajectory. As my colleagues have already previously noted, the COVID-19 pandemic amplifies the importance of building resilient national health systems and strengthening regional cooperation for health. It has shown that with increased global connectivity, a novel coronavirus of modest virulence can spread around the world within 6 months, and that local control measures can slow down, but not altogether stop these outbreaks. It also demonstrates the limited preventative and curative surge capacity for emergencies that are in place in most countries, and the reliance on quick technical and financial assistance that we face when such challenges arise. Furthermore, it underlines the importance of the prevention and control of NCDs. As communicable diseases cross borders, regional cooperation in health is crucial in addressing them. At the same time, if countries want to be able to address the infectious disease threat and the NCD burden, they need strong national health systems behind the borders. The two health challenges of communicable and non-communicable diseases are interdependent, and the success of the response depends on both a regional response and a global response, and strong national health systems. Let us quickly look at some of the challenges faced by the health systems across the region now. Next slide, please. Currently, the health systems in the region are in transition, and several challenges remain to be addressed. This slide shows 5 out of the 6 so-called health system building blocks that constitute the main pillars of a national health system. It shows the areas of improvement that would help CAREC countries in addressing the identified health challenges. As discussed under the previous slide, the financial burden for countries will increase with the increases in the NCD burden and aging. Over the past decade, public finance to the health sector has been increasing, but it remains low and insufficient. And a very significant financial burden is being passed on to households in the form of out-of-pocket spending. Many CAREC countries have introduced national insurance systems and schemes to help mitigate this financial burden for individuals, but it often remains difficult for individuals, communities, and populations to access care if they do not have the financial means. And if they forego such timely care, it becomes difficult to then and more expensive to treat the diseases as they progress. The region has also seen improvements in service delivery. However, disparities remain between rural areas and, as I already pointed out, with limited financial access between wealth quintiles. Challenges in the health workforce also remain despite many countries investing in this area. The challenges include a rural-urban maldistribution, an aging workforce, lack of appropriate skills, and health personnel retention, as health care workers leave in search of better opportunities and remuneration, sometimes across borders. The region, on the other hand, has seen a significant improvement in data collection and information systems. However, they still remain fragmented, sometimes between federal and provincial levels, and very often among different disease silos. For example, HIV is sometimes tracked separately, immunization systems are tracked separately. And it would be beneficial to make sure that the data can be shared between different systems. Challenging factors for access to medicines also include quality, affordability, and availability. Next slide, please. As I pointed out, while building strong health systems can help address these challenges, there are specific regional and cross-border issues that require specific regional solutions. Examples of such regional determinants that impact health include climate change, trade, water access, and cross-border movements. Migration is one of the determinants with a regional dimension impacting health. Increasing labor migration coupled with challenges from infectious and emerging diseases in the CAREC region further contribute to an increased threat of infectious disease and pandemics. As you can see in this current slide, in 2019, about 10.3 million migrants from CAREC countries worked outside of their home countries. Cultural and structural barriers and lack of insurance often deter migrants from obtaining necessary and timely care, resulting in increased healthcare burdens from higher treatment costs and also a human cost. Migrants often work and live in poor conditions. They work under limited social protection and have poor access to health and other social services. These circumstances in turn may contribute to health hazards, especially infectious diseases. This is further compounded by high out-of-pocket spending and lack of access to care for vulnerable populations back in the host countries and in the origin countries. It is important to note that migrants contribute significantly to regional economies in CAREC. Remittances from migrant workers constitute an important income source in the region. And provision of healthcare to migrants can bring significant benefits, not only in terms of healthcare to the migrants themselves, but also from an economic standpoint to the host countries and countries of origin. This is an example of how investment in health and regional cooperation around health can contribute to regional economic growth and prosperity. The current COVID pandemic has shown another side of the same argument, that diseases can have a significant negative impact beyond the health sector on the economy, trade, employment, tourism, and other sectors. Next slide, please. In the health sector, the COVID pandemic has further put a strain on the national health systems and increased the urgency of a coordinated response. It has resulted in unprecedented infection and death rates, as well as further stretched national health resources ranging from equipment, laboratory services, and health workforce. It has also negatively impacted the provision of other essential health services, such as chronic disease management, immunization, and others. This will have further negative implications for the health sector in the longer term. And from a regional perspective, the return of migrants has also further increased risks of transmission at the regional and national levels. We have seen that several other regional blocs, such as the EU, the Greater Mekong sub-region, have been preparing regional responses to this challenge. And while conducting the study, we have identified multiple regional drivers that could further support the strengthening of a regional approach to health and care. Next slide, please. I will now briefly go over the identified drivers and opportunities for regional cooperation in the CAREC context. Next slide, please. Based on regional cooperation experience in other areas and regions, and the particular context of CAREC that we have described above, several drivers of regional cooperation were identified across 4 dimensions. To summarize, regional and cross-border cooperation is driven by joint regional interests and benefits. Successful regional cooperation depends on factors such as leadership, consensus, technical capacity, and resources. From a cultural perspective, CAREC countries have a long historical relationship. Several share regional lingua franca, others share significant healthcare similarities due to previous healthcare models, as well as historical healthcare professional education models. From a geographic and demographic factor standpoint, they're also a good source of support for strengthening regional cooperation, since countries in the region share common borders, as well as several of them facing difficult mountainous terrain. This factor has in fact already led to several countries working closely together in areas of cross-border health service provision and telemedicine. From a regulatory perspective, several countries in the region have already established bilateral agreements and are part of regional discussions and agreements through bodies such as the Eurasian Economic Union, the Commonwealth of Independent States, the Belt and Road Initiative. For example, there is a provision for a common pharmaceutical market under the Eurasian Economic Union. However, there's further scope for support in terms of implementation. From an economic and technological driver standpoint, there can be a lot of significant benefits in terms of efficiency gains and economies of scale. Multiple countries in the region are already involved in joint procurement initiatives for vaccines, therapeutics, through mechanisms such as Global Fund, Global Drug Facility, UNICEF, and Gavi. The economies of scale resulting from such regional cooperation, for example, from bulk buying and sharing of information, can help reduce prices, can help augment financial and human resources. Further efficiency gains can be achieved by providing e-learning opportunities for healthcare workers, by further investing in digital and innovative tools, for example. This became even more acutely relevant under the current conditions, as such digital tools can be used online without exposing people to further infection, can help upskill and support healthcare staff as countries face the novel COVID challenge. Next slide, please. Based on the identified challenges, the CAREC regional context and drivers of cooperation that we have described above, the scoping study identified 3 priority areas for regional health cooperation. Next slide, please. These 3 priorities include regional health security, which is defined as the activities required both proactively and reactively to minimize the danger and impact of acute public health events that endanger people's health across geographic regions and borders. The second priority identified is supporting health systems through regional cooperation. And the third identified priority is the improvement of health services for migrant, mobile, and border communities. I will draw your attention to each of these in the subsequent slides. Next slide, please. Looking at the first priority in more detail, strengthening regional health security. In support of regional health security, over the past decade, CAREC countries, led by the Ministries of Health, have been advancing implementation and maintenance of the international health regulations that are an international mechanism for strengthening core capacities for disease control and management. Following the international health regulation indicators of preparedness for emerging diseases, several countries have conducted joint external evaluations and prioritized health crisis management and preparedness in their national plans. These national efforts could be supplemented further. One example would be to support these efforts with a forecasting and modeling element that would allow for better preparedness and more accurate costing for future outbreaks and pandemics. From a regional cooperation side, several countries have introduced bilateral agreements to facilitate surveillance and referral of infectious diseases. Global and regional initiatives have also been undertaken to strengthen health security through Global Health Security Agenda and to enhance human and animal health collaboration through One Health Initiative. Experiences have demonstrated that cross-country initiatives can encourage and sustain national efforts. The CAREC countries have been improving their international health regulation scores, especially at the national level. However, there is scope for improvement at the regional level. Next slide, please. Several priority focus areas were identified for further enhancing regional health security. For example, the substantial costs addressing infectious and emerging diseases make it urgent for countries to introduce and strengthen measures at national and regional levels, particularly in responding to pandemics like COVID-19. The efforts that many CAREC countries have already undertaken in addressing the infectious diseases threats could be enhanced by establishing and strengthening regional dialogue, administrative structures and coordinating bodies. And an example would be, for example, a regional health emergency center or regional rapid response team. Enhancing regional laboratory capacity, information systems, and surveillance would further facilitate information sharing and may result in efficiency gains in terms of time, human, and financial resources. In the current context, this may take the form of joint activities and enhanced safety monitoring for COVID-19 vaccines, for example. These activities are aimed at making sure that any new information collected post-marketing of the vaccines will be identified and evaluated as quickly as possible, and appropriate regulatory actions are taken in a timely manner to protect patients and safeguard public health. As already mentioned earlier, capacity building and training of human resources is another priority area for enhancing regional health security. Examples here include regional training and e-learning opportunities for field epidemiologists, infection prevention and control specialists, as well as others. In the area of service improvement and access to medicines, example of regional cooperation could include joint procurement of vaccines. For example, Patrick mentioned the COVAX facility and regional agreements and stockpile. Based on initial prioritization, the high health threat from infectious diseases such as COVID-19 could be addressed in the immediate future joint efforts. And there are also several other efforts that have been identified for regional cooperation to address NCDs in the CAREC context. Next slide, please. As we have seen, the building blocks for enhancing regional cooperation and addressing NCDs may look similar to those under the previous priority area of health security. However, the type of activities and interventions are different since the focus is on non-communicable diseases and there's more emphasis on economies of scale and efficiency gains versus cross-border activities. There are already multiple examples of regional cooperation around non-communicable diseases in the region. These include the establishment of a regional pharmaceutical market under the Eurasian Economic Union, as well as monitoring of several global indexes such as SDGs and UHC. There are also ongoing efforts on joint procurement of therapeutics for chronic conditions, as well as telemedicine and e-learning projects. These regional efforts can be further supported and expanded in scope. However, more analysis and discussion is necessary in order to prioritize specific focus areas. Next slide, please. In the course of the study, multiple initiatives and policies aimed at providing access to healthcare for migrant, mobile, and border communities were identified. Next slide, please. They ranged from national level interventions, such as providing information at pre-departure stages, to bilateral initiatives such as access to services for certain infectious diseases, to regional level initiatives such as the introduction of the Commonwealth of Independent States migrant cards. In the first instance, focus under this priority could be directed at further widening and deepening the scope of these already ongoing regional initiatives, such as, for example, including additional diseases within the package of services accessible to the migrant and mobile populations. In the longer term, the CAREC member countries could further expand the initiative to ensure full portability of health and other social benefits for migrants and other vulnerable communities. Examples of such portability can be seen in several other regions, including the neighboring EU and Mercosur. Overall, the study has found that CAREC countries recognize that regional health cooperation is vital in managing regional health risks and supporting national health system development. Regional cooperation in health is found in several national strategies, particularly in cross-border control of diseases, preparing for pandemics, seeking common solutions for non-communicable diseases. However, there is scope to further promote regional cooperation in the health sector, with CAREC providing a significant regional platform for achieving such regional cooperation. Thank you for your attention, and I pass on the word to Kirti, who will go over the recommendations that were identified as part of the study.
Thank you very much, Masha. So I will keep this brief, as many of the ideas were already outlined by Masha earlier. The scoping study identifies several recommendations along the 3 priority areas, and in addition on institutional arrangements. It recommends a gradual approach with short-term and long-term recommendations, and the details can be retrieved from the draft study. There is a table 8, that has more details. Just to summarize a few key recommendations. So the first set of recommendations relate to strengthening regional health security. The scoping study proposes to start with the most immediate opportunity, which is actually distilling lessons learned from the COVID pandemic and its response in the region, to then inform strengthening regional health security. It also suggests further scoping some of the mechanisms that have been touched upon in the study through more in-depth assessments, such as, for example, joint outbreak investigation, strengthening regional laboratory capacity, regional emergency stockpiles, and possibly joint procurement during crises. Of course, continuing to strengthen national health security will remain an important pillar for regional health security. The second set of recommendations relates to supporting health systems through regional cooperation. And this set of recommendations includes, for example, enhancing regional human resources for health in areas of mutual interest. These could be facilitated by the number of new emerging e-learning and digital tools. Also promoting not sharing on the implementation and use of innovative ICT is one of the recommendations under this set. The third set of recommendations concerns improving health services for migrants, mobile populations, and border communities. To this end, the study suggests also to further scope potential in these areas, such as developing health services along the CAREC economic corridors, like the Almaty-Bishkek economic corridor, provision of cross-border specialty care and referrals, and assessing the current state of portability of healthcare benefits. The last set of recommendations relates to institutional arrangements to promote regional dialogue and cooperation under CAREC. And specifically, it proposes to establish a regional health coordination mechanism, which could begin with establishing a working group for health. The study further recommends to develop a CAREC regional health cooperation strategy with an investment framework. And an additional component to this set of recommendations could also be to build leadership for regional cooperation, which also includes health diplomacy in the region. So with this, I would like to conclude this presentation, and thank you very much for listening.
Thank you, Kirti and Masha, for presenting the scoping study, which provides a comprehensive picture of the region's challenges and opportunities for health cooperation. Thank you. And Kirti, please continue presenting on the ADB technical assistance in support of CAREC Health Cooperation. Please be brief. Thank you.
Yes, thank you, Xingwen. So to implement some of the recommendations from the scoping study, ADB has mobilized funds for a regional technical assistance for CAREC countries. Next slide, please. The TA combines support in 3 related areas: regional cooperation for health, building resilient health systems for the future, and given the global pandemic, the TA also provides support to COVID response and recovery. The TA was approved in July 2020, and the implementation period is for 3 years until July 2023. It has an overall budget of 3.9 million and is funded from various funds, which you can see in the slide. Next slide, please. Today I will only give a brief overview, and hopefully in the future we'll have more opportunities to discuss this TA. So the TA has 3 outputs, namely enhancing capacity to respond to COVID-19. Secondly, developing capacity to prepare, mitigate, and respond to regional health threats. And under output 3, the TA proposes to support the regional health cooperation strategy and investment framework as suggested in the recommendations. Next, please. We have further divided the TA into work streams, which may be further refined during implementations. The work streams are all related to each other. Next. The first work stream relates to advancing digital solutions. This work stream foresees to implement pilots in digital health. Most of those will probably be national in scope, but some of them could also have a regional dimension and facilitate information sharing. A second work stream will support developing innovative models for COVID-19 response and facilitate knowledge exchange in this area. The support is also more targeted at the national level, but again, we have seen that especially under the regional health security recommendations from the scoping study, these areas are very much related. The third and fourth work stream explicitly support regional cooperation. Work stream 3 will support developing and strengthening regional cooperation mechanisms. This will be explained in further detail on the next slide. Work stream 4 will facilitate institutionalizing regional health cooperation. Sorry, previous slide again. Thank you. Including the formation of a potential CAREC working group for help and developing the strategy. Previous slide, please. The support for all these areas will be refined, of course, in dialogue with countries and will be based on needs identified during these dialogues. And I should also note that the TA will encourage, of course, collaboration also with partners and technical agencies such as WHO in implementing the activities. So quickly zooming into the third work stream, this work stream will support more in-depth assessments on cross-border and regional solutions, including but not limited to the recommendations in the scoping study. It also foresees to provide costed work plans for at least 2 of these mechanisms. Again, the topics and priorities for these regional mechanisms will be further refined in dialogue with CAREC DMCs. This work stream, next slide, please. Thank you. Next. This workstream will also provide capacity development on regional cooperation. Initially, these will be virtual events. Later, also, we can support workshops, study tours, simulation exercises. And it is also planned to establish a virtual platform that will facilitate knowledge sharing and exchange between countries. Last slide, next slide. Thank you. These are the tentative implementation timelines for this year and next. And of course, the implementation period will go beyond until 2023. So we are in October now, and the scoping study has been disseminated. We are holding the workshop today. By December, we plan to have a kickoff meeting on this technical assistance after we have onboarded consultants. Then starting late this year and throughout next year and beyond, we may start with activities such as workshops, carrying out in-depth assessments for selected topics, facilitating a CAREC working group for health, and eventually also preparation of the CAREC regional health cooperation strategy. And with this, it remains for me to say thank you very much, and we look forward to working with you on this. Thank you.
Thank you, Gertie, for the brief and concise presentation. May I now turn to our distinguished participants from the CAREC countries to share their comments and views on the draft scoping study. I would like to thank you all for your patience. I hope all the presentations provide sufficient information to help your understanding of the background for the scoping study and the importance of CAREC cooperation in the health sector. So before inviting our country participants to share their views, I would like to ask you kindly to keep your interventions within 5 minutes in accommodating the time constraints for the virtual workshop. May I now, with that, may I now have the honor to invite Mr. Bashir Normal, Deputy Minister for Policy and Plan, Ministry of Public Health of Afghanistan, to share his insights and comments. I would like to inform you that Afghanistan is the chair country of the CAREC program this year. Deputy Minister Normal, the floor is yours, please.
Thank you very much. Hello and have a nice day, colleagues. It's Dr. Abdullah Fahim. I am the Senior Advisor to the Minister of Public Health and International Affairs. Unfortunately, our Dr. Bashir Normal has left for one of the provinces because of a health emergency. That's why he was not able to join the meeting, and I am representing the ministry. First, I thank you, dear colleagues, for comprehensive presentations and for the preparation of the study. Let me first express that we are grateful to ADB support helping Afghanistan manage COVID-19 pandemic. Afghanistan believes in regional cooperations. That's why it's already involved in different regional activities. At the meantime, Gavi and WHO, besides other entities, supported Afghanistan during this COVID-19 crisis and continue to do so by COVAX facility. We highly appreciate the support. Dear colleagues, despite recent endeavors, our health system is far from expected capacities and poverty continues to double this burden. Having big immigrants and displaced people and deprived areas, we do support the scoping study. We do support, in the meantime, the recommendations made through this study. As you are in picture, Afghanistan is going through one of its history's difficult times. If we cannot be as proactive in this process as expected, you can understand that. We are looking forward to a peaceful negotiation process at Doha, Qatar, to put an end to long-lasting calamity of our people. Wishing you all the best in your humanitarian efforts and reiterate Afghanistan's Ministry of Public Health support in collaboration to this regional initiative. Thank you.
Thank you very much, Afghanistan, for sharing your comments and views on the scoping study and also for your support for study and for the recommendations. May I now invite Mr. Ramin Agayev, Head of International Cooperation Department, Administration of the Regional Medical Division's Public Legal Entity of Azerbaijan, to share his views and comments. Mr. Agayev, the floor is yours, please. Azerbaijan, hello. Mr. Agayev, are you there?
Good afternoon. Dear colleagues, I'm Rami Nagaev. I'm the head of International Cooperation and Protocol Division of TABIB. It's the administration of the regional medical divisions, which is under the State Agency on the Mandatory Health Insurance. I'd like to inform you that on behalf of Azerbaijan, Mr. Dr. Kahraman Hakverdiev will Yes, Mr. Kahraman Hakverdiev should have a speech. Because if he's not here, we're trying to connect him.
Okay, Dan, would you mind, can you speak later? Yes, okay, maybe we will wait for the Azerbaijan head of the delegation to get connected. And may I now call upon Mr. Lu Min, Director of the Division of Europe and America Department of International Cooperation of the National Health Commission of the People's Republic of China, to share his insights and views. Mr. Lu, the floor is yours, please.
Yeah, hello. Good afternoon, dear colleagues. Thanks for your cooperation introduction of the workshop of the regional future cooperation plan. I think that is a very ambitious plan and covers some of the important issues about
Oh, okay. Okay. Thank you. And sorry, Mr. Lu, the Azerbaijan delegates has come back and get connected. And then Azerbaijan, please. Hello, Azerbaijan. Can you speak now?
Mr. Kahraman Hakverdiev, he tries to get connected because due to the certain situation in the country, we may be interrupted. Internet connection sometimes interrupts.
Okay.
That's why now Mr. Hakverdiev tries to connect.
Can you connecting him and can he speak after PRC, please?
Yes, we're calling him and telling him that he's gonna speak after.
Okay, after PRC, please.
Yes.
Oh, okay. Then sorry, Mr. Lu. Sorry, please. Can you kindly continue? Thank you.
Yeah, thank you, Dr. Wang. Just to continue, I think that the ATB has developed an ambitious plan for the regional health development, and I think that it will be useful for the regional countries to combat COVID-19 and future health systems. And also, we noticed that from China and also the regional countries, they have developed some of our own national health strategies and also some regional health strategies, such as they have the Shanghai Cooperation Organization health strategy. So we want to make it clear what is the difference between the national health strategy and the regional strategy, and also maybe from our new health development system, what is the difference between the other? They have established regional health strategy, such as Shanghai Cooperation Organization. And also the second, we think that they have make up a target and some of the route to reach the target. And some of the approach should be more clearly and modified, and should be conduct further discussion with some of the regional countries. And also, we noticed that from our introduction, we have make our regional strategy. How about the regional strategy to support the country's development strategy? I think that is very important because different countries have different situation. The regional strategy cannot cover or need the regional countries' strategy. So maybe should we conduct further discussion about that? And from our China side, we will like to contribute our experiences with our regional countries and also with ADB, and just waiting for the future cooperation with our ADB colleagues and the country colleagues, just working together to conduct further discussion and to develop a comprehensive our regional health strategy. Thank you very much.
Thank you very much, Mr. Lu, for your remarks, and also thank you for offering PRC's experiences to health countries in the region. And regarding your questions, maybe I can just provide very brief answers, because this is the scoping study. It marks the start of the health cooperation under the CAREC program. And so the health strategy is our plan, and then also it's being prepared to help the region to formulate coherent and a joint action plan to support regional health cooperation and health sector development. And I think there is no conflict with the health strategy and the Shanghai Cooperation Organization, and it should be mutually complementary. And as you mentioned that we should support the national health sector development. Yes, for sure, that's one of the purpose of our health cooperation. So strengthening national health systems is one of the priority of the health sector cooperation. And we can further discuss and after the workshop. Yes, thank you. So now is Azerbaijan reconnected? Oh, you want PRC?
Yeah.
You want to?
Hello,
okay.
Hello, Madam Chair. Thank you very much. This is Sean from the the Division of Asia Pacific Affairs in the Department of International Cooperation of the National Health Commission. I'm doing the affairs with the ADB related mechanism. That's why I participated in this work. And thank you very much for circulating such a very comprehensive report on the scoping mission for establishing a health cooperation mechanism under the CAREC. And as the report said, this health cooperation mechanism will doing the cooperation for the infectious diseases, health securities, health system strengthening, and One Health approach, as well as we will touch upon the migrant health issues. We consider it is very important, and it is really very comprehensive. And as just Mr. Lu said, it is very ambitious. We really China really appreciate that. As a CAREC is a region with economic integration, we consider it is necessary to enhance the cooperation in this region. And we also notice that in the scoping report, we will touch upon the cooperation areas, which will related to the a lot of government agencies. That means we have to take a multilateral approach, and we consider it is very important to address the health issues in this region, but we still consider it is very challenging for so many countries to take a multi-sectoral approach to do such kind of a cooperation. And also, as Mr. Lu mentioned, that we still have some health cooperation mechanisms, such as Shanghai cooperation mechanisms, which we have overlapping countries there. So as the ADB is a development bank, and to my understanding, ADB will doing the cooperation related to, how to boost the economy development. So we hope in this scoping mission or the future possible health working group under the CAREC can further elaborate its added value of the health cooperation on the CAREC, and as well as the comparative advantage of CAREC health cooperation comparing to the other health cooperation mechanism already existing in this region. And we find that this is I consider this is the very first exchange and communication on the health cooperation under the CAREC. We consider it is very good and very necessary for the further integrated health cooperation and strengthen cooperation in this area. So we consider it is, if in the future we can have more technical workshop with the specific themes which mentioned in this report, the scoping report, we can find more areas for cooperation with the mutual interest of all these countries, since, as I noted, that this report just down by the desk review and the literature review, rather than a in-field on-site scoping or interviewing. So we consider if we, in the future, if we can have more workshops, we can find specific needs for cooperation in this region for the possible, the future health working group under the CAREC. And another challenging issue, we are considering that how we can coordinate, as you said, that we will complement the other cooperation mechanism in this region. And I consider we still have a good, it is better or good to have a coordinate mechanism with the existing health cooperation bodies in this region. And at the very beginning of the design of this health working group, and I consider it is a good point to have a deep consideration on this. Thank you very much.
Thank you, Ms. Shao, for your remarks and a very comprehensive review of the scoping study. Yes, as I explained, this scoping study represents the very start of health cooperation under the CAREC program. So as our director, Savdar, has explained earlier, so the CAREC program, so we support the region's economic development, but through interventions, through our support in the various sectors. So traditional sectors like transport, energy, so we have done a lot of projects, but in the recent years, so our program has expanded into social sectors as well. So that's why we feel it is important to support regional health cooperation under the CAREC program, particularly given the current situation of the COVID which has greatly affected all the regions and the countries. So we agree with the suggestions you have recommended, establishment of working groups for technical discussions, and also focus on specific themes and areas. I think that are all our plan during our next phase of the activities under the technical assistance, which has been introduced by my colleague Kurti. PRC for sure will be a major player in this regional cooperation process. So we look forward to working with you, also to PRC's contribution to this process. So thank you very much. I think Azerbaijan has come back. Now, may I invite Mr. Kahraman Hagverdiev from Azerbaijan to speak. Azerbaijan, please.
Здравствуйте, дорогие участники встречи. К сожалению, у нас немножко проблемы с интернетом, поэтому я немножко постараюсь быть краток, пока связь не прервалась.
Well, the connection is still here. I represent the Ministry of Health of the Azerbaijan Republic. I'm the director of the Public Health and Reforms Center under the Ministry of Health. I'm very happy to participate in this most interesting meeting. And we have gotten acquainted with the draft report. Overall, it is quite detailed about the state of health in Azerbaijan and other countries that are members of CAREC. As it is mentioned in the report, in reality, most of the countries presented in this new project have some historical peculiarities. Our health is based on Semashko principles, but after the collapse of the former Soviet Union, over the years of independence, many of our countries have not really deviated too much from that system. But recently, Azerbaijan and other countries are engaged in reforms of their healthcare systems. We're developing the HR, we are reforming the primary care, we are shifting towards mandatory health insurance. And as far as I understand, in the CAREC countries, the same reforms can be observed. And therefore, it would be very interesting for us to have some information about these reforms, about the problems that these countries are facing, and about the success stories that they have. I would also like to say a few words about something else. It's a different aspect of our cooperation that has been mentioned on a number of occasions in this report. That's the development of digital and innovative technologies. The pandemic has made these issues. There is an interruption in the connection. The interpreter cannot hear the speaker anymore. There is an interruption, unfortunately. There is no feed coming from the speaker anymore. Still nothing. I think we lost Azerbaijan.
Okay. So we lost Azerbaijan again. I think the delegate has delivered several key messages. So are you back, Azerbaijan? Okay. I think he raised several key issues, including the need on knowledge sharing on the health reforms that are happening in other countries, and also the importance of applying digital technology in the health sector. And these are all the important areas which will be included in our the phase of the activities in implementing the ADBTA. Okay, so let me now invite Ms. Kat van George Nashvini, Senior Specialist of the Department for Healthcare Policy, Ministry of Internally Displaced Persons from the Occupied Territories, Labor, Health and Social Affairs of Georgia, to share her comments and views. Ms. George Nashvini, the floor is yours, please.
Hi, distinguished participants and ADB partners, thank you for convening today's workshop. It is my pleasure to participate in this gathering, which is dedicated to promote human health and well-being of population within the Central Asian Regional Economic Cooperation. I would like to take this opportunity and express my deep gratitude to the Asian Development Bank for the support rendered to our country over the years. This scoping study provided by ADB will provide significant opportunity to the member countries to take steps toward achieving UN Sustainable Development Goals, as it summarizes achievement and challenges of health system in the region, provides recommendation and highlights the need of and opportunity for health cooperation under the CAREC program. The rapid spread of COVID-19 pandemic once again underlines the importance of standing together, collaborating and supporting. The first cases of COVID-19 in Georgia were confirmed on February 26. Limit has taken socially vulnerable families, people with disabilities. Georgia has been a successful case COVID-19 response across the WHO European region. However, in order to maintain this current success, it requires additional substantial financial support from the various donors. The Ministry IDP's Labor, Health and Social Affairs of Georgia expressed gratitude to all international partners for all efforts and support rendered to the ministry efficiently respond to COVID-19 pandemic. Along with other donors, the Asian Development Bank supports Georgian emergency COVID-19 response project with overall objective to prevent, detect, and respond to the threat posed by the COVID-19 pandemic and strengthen national system for public health preparedness in Georgia. I hope that through consolidated efforts, we will be able to successfully overcome challenges related to COVID-19 by support of the CAREC program. Thank you for your attention.
Thank you for your insights and views, particularly on the need to cooperate to fight against the COVID-19 virus, which is still evolving. Thank you very much, Georgia. Tajikistan has raised a hand. So Tajikistan, can I call for Tajikistan?
Здравствуйте, уважаемые коллеги.
Good afternoon, dear colleagues. I represent the Ministry of Health of the Republic of Tajikistan. I work in the Department of Reforms and International Relations. Overall, I'd like to thank you for inviting us. Thank you for the presentations. Thank you for your cooperation and support. Overall, we have reviewed this document at the level of the ministry up to the level of the deputy minister, and we support this cooperation in the region. We are ready to cooperate in the future. Thank you.
Thank you, Tajikistan, for your short intervention and for your support. We understand that you will be leaving soon, so we appreciate that you speak in advance. Thank you very much, Tajikistan. So now let's call for Ms. Botagos Smagolova, Head of Eurasian Integration Division of the Department of International Cooperation and Integration, Ministry of Healthcare from Kazakhstan, to share her insights and views. So Ms. Smagolova, the floor is yours, please.
Good afternoon, dear colleagues. I welcome you and greet you on the behalf of the Ministry of Health of the Republic of Kazakhstan, and I would like to extend my gratitude to the organizers, the Asian Development Bank, for the organization of this workshop and for the presented draft study. Of course, a lot of effort has been invested into this, and we appreciate this effort. Of course, our detailed proposals and suggestions will be presented to you in due time, but I would like to note that, of course, the coronavirus epidemic has become the test of our unity, I mean, the countries of this region, and it has demonstrated the key importance of international cooperation, interaction, and support in fighting this infection. From the moment the epidemic broke out, we were in close contact with all the countries across the region. We exchanged information, we coordinated joint actions and activities, and we offered mutual assistance to each other. That includes humanitarian assistance and practical assistance. And we would like to thank the countries that have helped the Republic of Kazakhstan in this regard. We are grateful to all the countries. Of course, the infection has demonstrated a number of problems that we have in our healthcare systems. That includes global problems, and they're very similar in reality because most of our systems came out of the Soviet system, despite the fact that a number of reforms have been implemented. The level of the healthcare systems is different in different countries. However, the nature of the problems is pretty much identical. And we now assume that we need to strengthen and channel all our efforts to the implementation of actions aimed at tackling the problems that the pandemic has unearthed. As you know, very recently, the International Rating of Healthcare Systems was published, and Kazakhstan is on the 53rd line of that rating. This shows, how should I put it? This is the best indicator of all CIS countries, but still there's a number of problems that are yet to be tackled in the healthcare system of Kazakhstan. And this platform, this initiative, the initiative to create a working group to discuss this project, I think is very timely and very topical. This is something that Kazakhstan supports, and we will invest all our efforts to actively participate in this project. We are prepared to discuss the recommendations and the solutions that have been presented to us. Thank you.
Thank you very much, Kazakhstan, for sharing your views and insights on the scoping study and also on the fight against the COVID-19. Yes, to effectively respond to the COVID-19. So we have seen that countries in the CAREC region have worked together, as you have mentioned, to provide the technical assistance and also humanitarian support. So, the COVID-19 actually reinforces the need to expand the health cooperation into broader regions and also to get the countries better prepared for the future health risks such as the pandemic, and also noted on your outlining of the challenges in the national health systems in Kazakhstan and also in the CAREC countries. Thank you, Kazakhstan. May I now invite Ms. Zura Donungbayeva, Chief Specialist, Strategic Planning, Program Implementation Department, Ministry of Health of the Kyrgyz Republic, to share her views and comments. So, Ms. Donungbayeva, the floor is yours, please.
Здравствуйте, уважаемые участники.
Good afternoon, dear participants. I would like to welcome you on behalf of the Ministry of Health of the Kyrgyz Republic, and I would like to thank the organizers for this meeting. I'd like to thank you for organizing this workshop. Having reviewed this draft study of healthcare in CAREC, the Kyrgyz Republic notes the importance of promoting regional cooperation in the area of healthcare, because this is the first step towards cooperation of our countries. We support further steps on improving regional health security, on the development of healthcare systems, and on the improvement of healthcare services for migrants. Our country, the Kyrgyz Republic, has adopted a national strategy for the development of the country up until 2040. As far as healthcare is concerned, we have a state program on the protection of health of the population and the development of the healthcare system up until 2030. And we'd like to note the importance of the development of the healthcare system in the context of CAREC. Within the framework of this study, we have seen the importance of assessing the needs of the countries in healthcare human resources. In relation to COVID, all the countries have faced new challenges, and this is why we need to note the importance of human resources for health in our countries. Also, within the framework of this study, I'd like to note the strengthening of intersectoral cooperation. We need to expand our cooperation in the countries that are members of CAREC, and we are prepared for cooperation in CAREC, and we hope that we will continue this cooperation going forward. Thank you very much.
Thank you very much, Kyrgyz Republic, for providing your comments and views, and also for bringing up the importance of regional cooperation in the health sector. So we have taken note of the Kyrgyz Republic's national health strategy until 2030. So I think it is very much a good timing with the CAREC health cooperation strategy, which is also leading to 2030. We have also noted the need of Kyrgyz Republic in the human resources of health. In particular, the country has large migrants which also need health care. I think all these issues we can further discuss during our next step of cooperation. Thank you, Kyrgyz. Right now, may I invite Mr. Faisal Rafik, Chief Executive Officer, Sabat Sahulet Program, Ministry of National Health Services Regulation and Cooperation of Pakistan, to share his insights and comments. So, Mr. Rafik, the floor is yours. Please, Pakistan.
Thank you very much. My name is Faisal Rifaq, and I'm representing the Ministry of National Health Services Regulation and Coordination of Pakistan. So, Zinglang, thank you very much. I appreciate your support in that. And first of all, just like to mention that I appreciate the Asian Development Bank for the wonderful done report. And I think I was able to, and Ministry was able to get a lot of information from what the CAREC report has mentioned, and the presentation in which the recommendations have been given, they are, I think, quite fruitful. And we can, especially keeping in view the current COVID situation, in which we all countries are facing in Pakistan. So just to give you what we are doing in Pakistan, the government of Pakistan is working on its national health vision, which through which the health services and we are is going to be improved, and the vision is till to 2026. And through that vision, the ministry and along with the provincial and the federal government, they are working on the universal health coverage in Pakistan, especially focusing on the financial health protection to poor, vulnerable, and marginalized families against catastrophic healthcare expenditure. For that purpose, the Sehat Sahulat program is working as a key player through which the financial health protection is being provided. We have learned a lot in last 8-9 months about how the things which we planned and then we face issues in the field, and we are working on overcoming those issues which we have faced during the COVID-19 situation. And we all in the Pakistan, we are looking forward to the support and cooperation of not only the Asian Development Bank, countries in sharing their experience of the COVID and pulling out new strategies through which we can improve our health sector, border immigration, health for the immigrants and for the other people. And I appreciate that all the management for organizing this such a wonderful team. But I will also request to share kindly the presentation in English also, so we can, the things which we have missed in for the in the presentation, which were some presentations were in different language. So kindly do share the English version with all, and I appreciate that. Thank you very much. Thank you.
Thank you. Thank you, Mr. Rafiq, for sharing your insights and comments. On the presentation, we should offer our apology. We should have shared with the president with you earlier, but I think the presentation was finalized a little bit late for sure. So after the workshop, so all the presentations will be shared with you, and we will also post it in the CAREC website. So thank you for your remarks, and we have so taken note of the Pakistan government's efforts in improving national health healthcare. So we have taken note of the national health vision up to 2026, and the government's efforts to trying to improve universal health care. And also we also have taken note of the government's efforts in overcoming the COVID-19 and also the impacts on all the on the people and also on the sectors. So, and we look forward also to working with you in the next step of these activities. Thank you, Pakistan. May I now call upon Mr. Javarov Navroz, Head of Department on Sanitary Epidemiological Safety, Emergency Situations and Emergency Medical Aid, Ministry of Health and Social Protection. I'm sorry, I think Tajikistan has already spoken. Now, may I invite Mr. Sakhamamdadov, Head of the Department of Finance, Accounting and Reporting, Ministry of Healthcare and the Medical Industry of Turkmenistan, to share his insights and views. So, Mr. Sakhamamdadov, the floor is yours, please. So, Turkmenistan delegates, are you here?
Yes, good afternoon. Yes, we are online.
Yes, please,
good
please
afternoon,
go
and
ahead.
We would like to
Здравствуйте еще раз.
Good afternoon, and we would like to express our appreciation to all of the participants for sharing your insights, your experience, as well as to the hosts for giving the floor to us. And we have just witnessed the presentations of the participants regarding the promotion of regional cooperation in the health sector under the CAREC program, and we have also reviewed the action plan. And we also would like to thank you for cooperation. Thank you very much. The floor is yours. Back to you.
Thank you, Turkmenistan, for sharing your insights and views. Yeah, thank you very much, Turkmenistan.
Большое спасибо представителю Туркменистана.
May I now invite Mr. Arubakun Kayumov, Head of International Department, Ministry of Health of Uzbekistan, to share his views and insights. Mr. Kayumov, the floor is yours, please.
Извините, господин Каюмов сейчас занят.
I would like to apologize. Mr. Kayumov is now busy. He had to leave for the Ministry of Foreign Affairs, and I will be speaking on behalf of the delegation of Uzbekistan. My name is Bahrom Garmanov, and I represent the Ministry of Health of Uzbekistan. I would like to greet all of the participants, and I would like to thank the hosts for the organization of this workshop, and I would like to greet all of you. And you may know well that Uzbekistan in recent years has been quite active in promoting regional cooperation in the CAREC region, and it has been taking unprecedented measures to promote international cooperation. And he's breaking up. And the speaker is breaking up. Now he's on pause. Also, the problem of COVID-19 is quite grave, is quite serious, and I would like to say that the pandemic of COVID-19 has given a great impetus to the development of our national healthcare system. Although we were sort of prepared and we had a system of preparedness for emergency situations, but the pandemic has forced us to take a view at some aspects of healthcare at a different angle, as well as we had to apply different approaches to our epidemiological response measures. And we actually managed to find out some very interesting solutions, specifically with regard to the international experience and in our own country as well. And it was quite challenging because many of our citizens are still outside of the country as migrant workers, and to be able to assist them to come back to Uzbekistan, we had to arrange for a great number of charter flights, and almost 400,000 migrant workers have returned over this period since March 15, when we registered our first case of COVID-19. And we also would like to thank all of the countries and all of those who were involved in assisting our citizens to return to Uzbekistan. And I also would like to take this opportunity to thank all of the countries who participated in exchanging and sharing their experience with Uzbekistan specifically. We have arranged for a great number of webinars with the involvement of specialists from such countries as Germany, South Korea, China, Russia, and Turkey. And the experts from these countries visited Uzbekistan and they worked in Uzbekistan. Some of them visited us several times, and their work was focused not only on the capital city of Tashkent, they also did field work in all of the regions, and they visited all of the even the most remote regions, and the fact that they shared experience is quite important to our doctors, to our medical professionals, because it is not enough to share a healthcare protocol. It is very important to share the best practices. And I also would like to thank Ms. Coopens as the head of the WHO department, which was quite active over this period from the start of the year. And we have already printed out the sixth version of our protocol on prevention and treatment of COVID-19. And these protocols, all of these protocols were based on the international experience, and it contributed a lot to reducing the mortality rates, which we have now. And we have managed to arrange for a quite satisfactory medical treatment in our country. And I would like to say that we now apply a multi-layer approach. We arrange for treatment at home, and we have also established special hubs for sorting out the patients, and we have also created over 400,000 beds, and we equipped them with the oxygen equipment. And it was also mostly due to the considerable international assistance. It was made possible through this assistance. And as regards to the CAREC initiative, with regard to the further development of our regional cooperation, of course, we fully support all of these steps. And we also need to arrange for a working group or a steering committee, and we need to do that so that it would be able to work remotely, because the pandemic situation has taught us a lot about working remotely, like we do now. And this experience was quite helpful for all of us. And also, we placed emphasis on the development of a digital healthcare system. Of course, it is also very important to us. And we also would like to invigorate our efforts in this area as well. And overall, even though in the past, we placed more emphasis on non-communicable diseases, COVID-19 has reminded us of the importance of placing more emphasis on infections. And so we need to reach the balance between treatment and prevention of non-communicable and infectious diseases. Thank you very much. Back to you.
Thank you, Uzbekistan, for sharing your insights and views, and for sharing the Uzbekistan's experiences in effectively responding to the COVID, and including your effective management of the migrants to get them back into the country, and also your practices in how effectively treating the COVID patients, and also in the digital healthcare. And we also noted Uzbekistan's active role in promoting regional cooperation in the recent years. So we look forward to working with you in promoting health cooperation in the CAREC region. So as the next steps, thank you very much, Uzbekistan. Now that all the CAREC countries presented here today have shared their precious views and insights on the scoping study, and also shared their experiences on their countries' responses to COVID-19, including through regional cooperation and joint actions with other countries. We have learned a lot. Thank you all for your insights, for your guidance, and for your contributions. Now, I think we have running a little bit behind the program, but I would like to open the floor for free discussions for 10 minutes. So CAREC country delegations, if you have additional comments to make, and development partners and the ADB colleagues are welcome to share your views and insights on the scoping study and also on the importance of regional health cooperation. You may also choose to share your comments in the chat box. Yeah, so we will incorporate all the comments received today, either oral or written comments, when we revise the report after the workshop. So now, now the floor is open. So who would like to speak first? Is there anyone who want to share your views on the scoping study and also on other related issues? Colleagues from ADB and also from development partners? Anyone?
Shinglin, can I just say something?
Yes, please, Sabda.
Thank you very much, colleagues. Very interesting feedback and inputs that we got in the meeting today. And I just really wanted to clarify that two things. One is that ADB intends to work very closely with the other development partners who are both specialized health agencies as well as other broader multilateral and bilateral partners. Under CAREC, we have no presumption of leadership in the health sector as such. It is just that we seek to provide a platform where countries, these 11 countries of the region, can come together, share lessons, and hopefully do some joint programming, looked at issues of pool procurement, and other relevant issues and areas where they can benefit from regional cooperation. And so we really seek to undertake a very collaborative approach here and really work with the other development partners to see what kind of common platforms we can develop in this region. I think secondly, I just wanted to say that the idea very much is that a regional strategy complements national strategies, because national strategies usually stop at the borders, whereas the problem that we are facing is goes beyond borders. So for example, how do we develop regional health surveillance systems so that the monitoring of a disease or an epidemic can continue and it contains the spread of disease over the borders, as just one example. And so really the idea is to supplement what is being done really at the national level and to bring in a regional angle, because we firmly believe, as I think one of the participants said, that both national as well as regional approaches are needed to achieve the health security targets of also of the sustainable development goals. So I just wanted to make those 2 points. Thank you very much.
Thank you, Safda, for the important clarifications and explanations. Yeah. Now, may I call upon Mr. Mohsin Khan, and he raised his hand.
Yeah, thank you very much. I'm Dr. Mohsin Khan. I'm a staff consultant working with the ADB Residence Mission in Pakistan. I have a very one quick comment. I think it would be great to see the technology-based solutions working over as part of the cross-border cooperation, because just working on these aspects at the national level would be great, but to bring them on as on a cross-border cooperation level would be of value and would be a great model to see how does that operate. Thank you. Over from my side.
Thank you, Mohsin, for bringing up that important point of technology-based solutions. I think it will be included in the next steps of our activities. So, hi, Dodo. So, Dodo, yeah, please.
Okay. Hi, Shinlan. Sorry. So, okay. It was quite wonderful to listen to the presentation, to the study, plus, of course, the insights of our friends from WHO and the support and the inputs that was provided by the 11 CAREC nations. What ADB has been supporting, in a sense, regional groupings. And I think there's a lot of lessons that can be learned, particularly in the work that we have done in the Greater Mekong Subsystem, which our friends from PRC is also part of. One thing we should note is that in this COVID pandemic, among the most best performing countries, if there was this Lancet report, were countries in the Greater Mekong sub-region. So the Lancet report talks about 11 countries that are doing well. It included all of them: Vietnam, China, of course, Thailand, Laos, Cambodia, and Myanmar. And we think that what we have done there as ADB is help this country to work together, including sharing of data, surveillance, including initial steps to make sure that migrant workers, which was discussed by Masha, will get continued access to healthcare services even as they move around different countries. There has been work that ADB has supported in strengthening of laboratories, in strengthening primary care at the ground and the border areas. And we look forward in bringing these lessons as CAREC, hopefully, will move forward into stronger regional health cooperation. So I think that's my point, Xinlan. We can bring this experience. We could bring this sharing among countries as the CAREC community explores stronger regional cooperation among themselves. Over.
Yeah, thank you, Dodo, for making that important point. Yes, of course, sharing of experiences, including with other regions, will be one of the important components of the regional health cooperation. So in the next steps of our activities, we will conduct workshops and also other knowledge sharing activities with, across CAREC countries as well as with other countries in the other regions, including the Greater Mekong sub-region, which they have already had a health strategy. I think their experiences can provide good lessons to the CAREC countries. Yes, thank you, Dodo. So anyone else who would like to speak, to express your views and comments? So I see that there are no hands raised. Okay, now I will just conclude this session. In this session, and we've heard the views and insights from our CAREC countries on the importance of regional health cooperation in addressing regional health threats such as COVID-19. And also we heard their advice and guidance on how to proceed with the cooperation going forward, and also how CAREC can play a facilitating role in the process. We are greatly encouraged by the high level of interest and the commitment from our countries in working together in the health sector, and to get the CAREC countries better equipped in continuing our fight against COVID and better prepared for future health threats in the region. So the discussions are so rich, and I think that I have difficulty to summarize that. I will leave this difficult task to Ms. Ria Hiraoka, Director of Social Sector Division of ADB's Central and West Asia Department, to deliver her concluding remarks. Ria, the floor is yours, please.
Yeah, thank you very much. And thank you very much for all the CAREC country representatives and our development partners and presentators. And particularly for the countries, I know that fighting with COVID-19 is far from over. Many of you are still facing the second wave, and we are very much aware of it and how stressful time this is. So I appreciate, yes, you are taking time to listen to and participate in this workshop to talk about health scoping study. Actually, we started preparing this scoping study last year before COVID-19 hit us. Then we rewrote it after this happened, and during the last 6 to 7 months, actually ADB also has been very closely working with many of the countries here, all of the countries here, and also Ministry of Health, and it has been a loud and clear reminder. Yes, regional health cooperation is needed. As Safdar said, we are not assuming we're not assuming a lead. We don't have any presumption of leadership, and many other development partners and countries themselves have a strong established strong health cooperation. But we would be very happy if this CAREC can add value to it, and we would continue to coordinate with other regional cooperation in health platform, as China's Chinese delegation mentioned. And so the discussion time probably was not sufficient. We didn't hear all the things you wanted to explain, so we will have other opportunities. But I heard a few. I just wanted to summarize what I heard. Yes. So I think the participants all supporting this health cooperation initiative, regional health cooperation initiative. And also they are very eager to learn from each other, not only on how to respond to COVID-19, but also the reform process, because many of the countries here started with Samashenko model. 30 years later, and reforms have taken place in a defined speed and defined forms in other countries, but still, I have worked with some of the countries personally. Then I could, yes, and confirm they are allowed to learn from each other how to develop health financing system, for example, and also how to develop health personnel. So I think apart from COVID-19 experience, we also want to have an opportunity to share these reform experiences to benefit the countries. And also I did hear also lots of interest in e-technology and e-health development. That's definitely the part of the scope of regional technical assistance support. And also some people commented, yes, want to move on to the establishing working groups and discuss much more concrete solutions and themes. And so these are all very important points, and we appreciate and consolidate, and we will divide this scoping study. So there are no, so we will again request if all the comments have not been expressed during this very limited time, kindly share and send your comments to us, and we will make it sure we'll incorporate that address them in scoping study, and then revise the study that's shared with you. And we will soon also inform you about, we already informed all the countries about regional technical assistance, and we will also keep you informed of the progress of regional technical assistance implementation. And we also would like to now, we hope to develop a CAREC health strategy and investment framework where we could also talk about concrete investments. So, and also that we just want to say, as Patrick mentioned, ADB also seriously is talking, just like other development partners, how to work and help the country to access vaccines and deliver the vaccines and vaccinate the population. What should the strategy be? So we will be working also again with you on this aspect. in a very near future. And we would like to, we look forward to continuing support and engagement for country in the region under the CAREC, and also we really want to work very closely with our development partners and existing regional health cooperation facilities and opportunities. So lastly, I would like to thank all the colleagues and who caused that to happen. I know how much work it went behind the scene. And thank you very much for the CAREC Secretariat and ADB and our country offices for their intense work behind the scene. Thank you very much. So I would like to ask Xinlan to give a bit more concrete timelines for the next steps. Thank you very much.
Thank you, Ria, for that very wonderful concluding remarks. And so I will just briefly explain the next steps. So after the workshop, so the team will prepare a summary of proceedings to share with the countries for comments. So this will be shared with you within 1 to 2 weeks. And meanwhile, we will revise the scoping study incorporating comments received today at the workshop, and other comments after the workshop will also be welcome. So the scoping study will be published this year. So I think that's basically on the scoping study part. So and Kurti, do you have anything to say on the TA?
Thanks, Jinglan. Since I already outlined a tentative timeline in the presentation, I will not elaborate further at this point, but we would look forward to meeting you all either virtually or hopefully in person in future to proceed with further dialogue on regional health cooperation. Thank you. All the best.
And thank you all very much for your participation and also for your contribution. Now the workshop and concludes. And wishing you all the best, and hopefully see you soon, virtually or physically, later this year or next year. Thank you all. Bye bye. Thank you. Bye bye.
Bye bye. Thank you, Xinlan.
Bye. Thank you.
Thank you.
Thank you, Xinlan.